Hi, everybody. Lisa Kessler today with Kessler Insurance, and here today on behalf of Cheers for Charity New Hampshire, and always with my dear friend Joanne. Hey, Joanne.
Hello. Hi, Lisa. Yes, I'm Joanne Burchuk. I'm with Lighthouse Physical Therapy, and we are happy to invite another guest to our little interviews here. And today we have Josie, who represents the Reproductive Freedom Fund of New Hampshire. So welcome, welcome. Go ahead, introduce yourself and tell us more about what your organization does.
Sure. So my name is Josie Pinto. I am the co-founder and executive director of the Reproductive Freedom Fund of New Hampshire. And our organization is a resource for folks that are looking to access abortion care services. We will help those people pay for their appointments, we'll help them get a ride to their appointments, and we'll help break down other barriers to access that they might have so that they can get the care that they want.
Very nice. And I'm sure there's many people that end up in that and don't know where to go. So, this is great that you can connect people with those resources, probably the education that is required during that process. Do you want to tell us a little bit about that? How do you work
Sure.
with patients? Yeah.
Yeah, absolutely. So most of our referrals come directly from local clinics in New Hampshire. So we tend to work with the Lovering Health Center, Equality Health Center, local reproductive health centers, and they've already identified that the patients that they're sending us to have a financial unmet need. They've already booked their appointments, so they've already kind of made their decision as to what they want. But they have some sort of barrier to actually getting that care. So that's where we come in. We connect directly with those patients after they've already scheduled an appointment, and we fund those clinics directly. So we just, go ahead and make a pledge for them and then pay the clinics directly so that they can get the care they need. We fully fund all Granite Staters in need. We've never had to turn a Granite Stater away. And to date, we've already helped more than 600 Granite Staters access abortion care in just about 3 years since we launched.
Wow. What a great opportunity for those people, especially, when they're in need and they can't afford it. So, great job for you guys for helping them out on the financial end. What are the requirements for somebody who is in need? I'm guessing there's some sort of vetting process on your end.
So we don't have formal requirements. We believe people when they say that they have a need, and we trust the people that we serve. So, we also trust the clinics that send them our way because they've already asked them a lot of questions around, their financial status. So we try really hard to not be another barrier in the system because our whole organization is focused on breaking down barriers to access. So, really, we just have a quick 5 to 10 minute phone call with the patient. We confirm a few details, get some basic information, and really just try to keep it short and simple for them. So, the only thing we really require at this point to get full funding is that you're from New Hampshire. Even if you have to travel outside of the state for care, as long as you're from New Hampshire, we will fully fund your care. We've also been able to help patients from 35 other states since Roe fell about a year ago.
Oh, that's wonderful. What kind of challenges are you guys facing?
Yeah. I think that, like I said, with Roe v. Wade falling, we did receive a lot of attention, a lot of support. But unfortunately, I think, especially in areas like New Hampshire where abortion is legal and accessible, the issue has died down a lot. But on the other hand, we're getting more requests than ever, especially from those patients living in states where abortion is now illegal. We get tons and tons of requests for support, and we're just not able to meet all the requests for support we get, especially, for the folks that are coming from out of state. So I think it's been a challenge in that, donations and support have been down while the patient volume has been way up, because, we just need those things to match up a little bit better. So I would just say, having to scale back the amount of support we're giving to patients not from New Hampshire has been the biggest challenge. And, of course, the issue of abortion itself can be difficult to navigate, because abortion is often othered as a healthcare service, which means even if you're a Medicaid patient and you can get every other healthcare service covered, you will never get abortion coverage through Medicaid. So a lot of the folks that we serve, they do have insurance, but their insurance won't cover it. So, we see a lot of that type of thing where people are just really surprised that their healthcare isn't going to cover a medical service for them.
Mm-hmm. And you find that's pretty typical of most insurances?
Yeah. So most insurances, it's either not covered or it's going to fall under a big deductible. So unless you've met your deductible or somehow have a low deductible, most people find that they have to pay for the full cost of an abortion. Unless they happen to be lucky enough to have no deductible or have already met it.
Yeah. And so just kind of curious, how much does one cost? I have no idea.
Yeah. So it can range a lot. On average, about $500.
Mm-hmm.
And 60% of Americans don't have a sudden $500 to cover an expense because obviously, this is something that happens pretty suddenly and you're looking to get care within the next week or so of finding out. And so, it is just a sudden expense that a lot of families don't anticipate or budget for. But also, I think one of the challenges of funding abortion is that the longer you wait, the more expensive it gets. So if you don't have money, if you don't have that $500, all of a sudden it's going to be $700. It's going to be $1,000 because the higher gestation, the more expensive it is. So it's really hard for people that don't have the money because it just keeps getting harder and harder for them to actually get that care. We've seen cases up to $30,000. Exactly. So, particularly in hospital settings. So yeah, I think it is a challenge because the range is so huge. But I would say on average about 500.
Yeah. I didn't realize the longer you waited, the more expensive it becomes.
Yeah.
Which I'm sure if somebody's kind of freaked out about it to begin with, they don't know what to do, and it may take a little while to process all of that.
Exactly. And, in a lot of states now, they're having to travel really far, coordinate plane rides, take time off work, find childcare. There's so much else that can go into actually setting up an appointment besides just the money. So we also try to help with all the logistical barriers as well.
Go ahead, Lisa, you were about to say.
The whole thing I have like 6 million questions and I can't figure out what to ask first. So this is for abortion for any reason, correct?
Yes.
Yeah. So, okay. So there may be instances where you hadn't originally planned to be in this situation, then due to medical conditions of the situation for a mom or whoever, right? Like, you may have decided later and now it's become significantly more expensive.
Yeah, we definitely serve a lot of people who have something called a fatal fetal anomaly. And what that means is that at their diagnostic ultrasound, which usually happens around 20 weeks of pregnancy, they find out that there's something seriously wrong with the health of their baby. That can be something like it's missing a brain or lungs, like really severe medical issues. And it is confirmed that the baby is not going to survive no matter what is done. And so those are the cases of, a handful of our patients. And those patients in particular, it's so hard because it is a very wanted pregnancy that they've been planning for. They're expensive, they're traumatic. And a lot of times, in those cases, insurance won't cover them either. So yeah, it's definitely a wide range of, people who already have kids, people who want kids, and this just isn't going to work out for them. So, I really try to highlight that every abortion story is different and deserves to be told because people find themselves needing an abortion for such a wide range of reasons. And it's not our job to judge or, have them change their mind. We are just here to help them actually be able to access it if that's their decision.
Mm-hmm.
And so I want another question on this. So, you've got obviously the patients, so the people in need who you're helping. How can people who do want to support your initiative, how can they get involved? I noticed on your website,
Sure.
you have some volunteering choices, opportunities in a volunteering form, those kinds of things.
Sure. Yeah, we have a couple ways that we use volunteers. Our hotline right now is pretty much entirely volunteer run, which means that we have a volunteer that's on shift for a couple days, and they're the ones actually directly connecting with the patients that call us. Another great opportunity that tends to work for a lot of different people, we have a network of volunteer drivers, and those drivers actually help patients get to their appointment. So we have right now a network, of all over the state, and we're always looking for more, just because, you never know how many drivers you have to ask before you can actually get someone a ride. So that's a great opportunity for someone that may have a more flexible schedule or maybe retired, to just offer to drive a patient and support them. Because a lot of times, people either they can't drive because they're going to be on certain medications, or they don't have a car. And so, yeah, sometimes getting to the clinic can be a really big barrier. So those are, I would say, the main two opportunities. But of course, the number one thing anyone can do is donate to our organization, because, our whole model is just giving people money when they need it. So it does take a lot of support from grassroots donors. So that's the number one thing, host a fundraiser, a bake sale, anything, tell your friends, because that's definitely what sustains our work the most.
Interesting.
You just mean it. There you go.
Taking notes on all this, so trying to get all this down. So I also noticed that there's additional information on your website that may be useful to some people. Want to tell us a little bit more about the additional resources that you provide? I know your big initiative is funding, but you also have information. Can you share a little bit?
I would love to. So another program that we offer is we give out free Plan B all around the state. Plan B is a form of emergency contraception. So you would use it within 72 hours of sexual intercourse if you're worried about pregnancy, and it prevents ovulation. And so we partner with local bookstores and coffee shops and, people all around the state that want to give it out for free. So feel free to go on our website, look at our map of over 35 locations, and all of those are trusted partners of ours that you can go access free Plan B through. And so we do really want to make sure people know that that's a resource, because again, that's an expensive thing that a lot of people don't have the funds for. Typically at, a local drugstore, you're going to see Plan B costing about $50. So again, we are just here to give it out for free to people. And we're trying to be in as many communities in New Hampshire as possible. So there's only a few towns, communities that we're not in yet. And we're always looking for more Plan B partners to help us get the Plan B in as many places as possible. So I would say that's our other major program. And then on our website, we also have a lot of information around where you can get an abortion, the different types of providers and methods. And we just try to, demystify it in general and provide helpful information and robust resources.
Yeah, fantastic. Yeah, it's funny because I did see that on your website, but I didn't know what it was. So I'm glad you brought that up, Lisa, because I honestly didn't even know to ask a question about it. I just thought that those were I didn't know. So that's
I
great.
knew because my office is in Newmarket, and Crack Skull supports the program. So we had already seen it. To get coffee. Our whole staff had a conversation about it seemed like at first everyone was trying to sort of figure out how the two fit together. So but to understand why it's in a coffee shop, right? Like and that it's there, it's free, as opposed to the expense of a pharmacy.
Right. Yeah. And part of that reason is really to just break down the stigma of it. I feel like sometimes the idea of someone, going to get a Plan B from CVS, it's, you have to deal with shame, or people perceive shame. I've heard stories of people being judged by pharmacists or the cashier. And so I think that it's an amazing thing when a business who's supportive of our mission can come out and say, we're going to normalize it. We're going to give it out for free, and we're going to make people who need this feel safe and welcome in doing so, because it really makes a positive interaction. When typically, it can be a hard thing for people to access emotionally, financially. So we're really just trying to break down all kinds of barriers and stigma.
Yeah. I love how easy that you make it. And just for clarification on that, if somebody was in that situation, how many days do they have before
Yeah.
it's not effective?
So it's 72 hours, but the sooner the better. So as quickly as you can take it, the higher the chances of it being effective, because all that it does is it prevents ovulation. So if somehow you have already ovulated, it's not going to be effective at that point. So yeah, but 72 hours is kind of the cutoff. There is another medication that unfortunately has to be prescribed by a doctor, but it's called Ella. And that is good for up to 5 days. So there is still another option, but yeah, you do have to, go to a provider or something like that just to get it.
Right. Terrific. Well, so what's the best place for people to find you?
Yeah, I would say our website is probably the most robust in terms of information about, what we do, who we are, who we serve. We're also on social media. I would say our Instagram is our most active platform, and our handle is at ReproFundNH. So those are the main ways. You're welcome to contact us through our contact form on our website as well.
Awesome. Well, Josie, this has been a great overview of what you guys do and how you help people in our community who are in need. And we appreciate you taking the time to share that with us today. Thank you so much.
Of course. Thank you so much for having me. It was a pleasure.
Yeah, thank you.